There are many reasons implants fail. If I had to say, my top threes would be gum disease, bruxism, and smoking. Things that can lead to failing in implants can also be caused by the operator. These can be from lack of planning and also not respecting the anatomy and putting implants in positions or into bone types that are less successful. Using products that are not as a high quality. Implants are, it's a part that's going to go to your body, so it's not a procedure that you want to cut costs on it. We want to put the best material in there, guaranteed for success. The other parts I really see that people are trying to cut costs on the laboratory part. So instead of using the high quality zirconia, that some providers are using plastic teeth or acrylic teeth as an alternative, which leads to high failure rates. But what patients can do to, guaranteed or increase the success rate is to take care of them as if they were their own teeth. You have to floss them, you have to maintain them, coming in with regular hygiene appointments. And if you do that, you'll have nothing but success.